Good evening to everyone and welcome to today's session. AIIMS November, already the winter has come. We will know when we solve the hard questions of the AIIMS November paper. And every year as a teacher, without discussing the November paper, it's like a annual academic feast. The questions will be new when none less than All India Institute, the great, composes the question paper. Some questions will be very nagging. Past 36 hours, only these 200 questions are revolving in our minds, at least some of those who took the paper, exam, actual exam. We find a lot of questions which we had in our earlier mock tests, which is coincidental, honestly speaking, no big deal. And exam becomes predictable if your preparation is good, if you are sharp enough. And it looks enigmatic and anonymous if you are still in the beginning stage of your preparation. It's only we reacting differently to the same situation which is called as exam. So we welcome our online students. I am very happy. Today we have a huge cross section across the country from Guntur, Kakinada, Tirupati, Dr. Brahmaramba, Shailaja, Aruna, and all the students online. So doctor, you are all given placards? You have given placards to everyone? Yeah, do it fast. So you need to react to what is your answer. I will anyway contradict your answer. Sometime I will make you unhappy when I give my answer. But my answer can also be wrong, because it is within the limited purview of what are the references available, and some of our consultants who are experts in their field. Problem is, a expert consultant's answer will be different from what textbook says. There are a lot of questions like that. We will come up the discussion. Now let us make a start, doctor. Root value of the nerve supply of the external anal sphincter. Please promote your answer. Very good. Yes, 2, 3, 4. Once more you are going to take All India MD entrance and the state entrances without a question on root value. There will be no paper. Let me be honest with you. Yes, 2, 3, 4. The sphincter anus is basically supplied by inferior rectal nerves and the perineal branch of the fourth sacral nerve. Fourth sacral nerve basically has got root value of 4, and S23 is the typical root value of inferior rectal nerves. S234 is what need to be remembered. One more bullet like question. Root value of the thumb and index finger. What's your answer? Huh? Yeah. We request our online students also to punch your answers. I hope the voice is loud and clear for the online students. Can you please punch whether the voice is loud and clear? That's good. Matthews is online today. So what do you say? B you want to say? Okay, what is the D option? C? Both are C6. Oh, that's good. You mean to say both C6 had also been given? Eh? Okay. Actually, the lateral arm, forearm up to index, long and ring finger. This is all by C7. Antearm, radial side of the hand to the thumb and index finger is basically by the C6. So he asked thumb and index. That's good. So we will all, please let us modify the answer given in the key later on. This question I could not really trace out, But are you sure 10 MB is being given? Any remote memory? If 10 MB is given, 50 was given, right? But one enigmatic reference I got was the karyotyping analysis. Whenever we do, the entire genome is identified at a resolution of approximately 10 mbp. So 50 MB was given is a opinion even among our online students, right? I don't know, that question will keep, that's a question not meant to be answered in a negatively asked exam. Why? Because if somebody answered even that question correctly means either he got a leak of the paper, or he is carrying a Bluetooth to the exam hall, otherwise very difficult. Okay, this question, this is another unreasonable question. There are so many beautiful fascia in our body, ultimately examiner want to know what are the contents of the mesorectal fascia. First of all, what is mesorectal fascia? Around the rectum, that is not Valdeyer, Denon-Villiers, they are all different. Around the rectum, surrounding it, that you have got the mesorectal fascia, which is a visceral part of the mesentery. So, what is your answer, doctor? Possible answer? Question number 4, please punch the question number and give your answer, doctor. You like to say C? We get one answer as pararectal nodes here. Shiloh is proposing inferior rectal vein. Any other proposal? Mesorectal fascia, right? Neha is proposing inferior mesenteric plexus, which is a very important plexus which innervates the rectum. It has to pass through the mesorectal fascia, there is no option. Even Durga online is also proposing inferior mesenteric plexus. But what is the truth? Who said B, doctor? Please give one loud clap for you to remember. B, that's good. Your name, doc? Deepika from which college? Gandhi, very good. So doctor, typically what do you have in mesorectal fascia? Mesorectal fascia, you are having fundamentally, I leave the literature for you, superior rectal artery and its branches, superior rectal vein and its tributaries, lymphatic vessels and the nodes along the superior rectal artery, and you also have the inferior mesenteric plexus which will be innervating the rectum, is what I want to underscore to all of you. Don't use pen. They are little late in photocopying the printout. They will give you the printout, no issue, and it is already made available online. So on your mobile phone only you can review, but you don't need to review. Another 1 month you are going to join MD. All this straw will be a wasted paper, wastage of the paper. So relax and then guess some answers. After all, what we are doing is guessing. Predominant blood supply to the stomach. Give an answer, doctor. I still didn't understand what is the meaning of predominant. Is there anything like predominant 80% is this vessel, like liver blood supply? Anywhere literature is there? I had been badly searching. The entire literature talks about what are the various vessels that supply, and nowhere percentages are mentioned. But I will give you a illogical but a logical logic. So Hussein, Shanti, Neha, everyone is proposing left gastric artery. I too think so. Why? Because the predominant blood supply of the stomach, whenever you say, basically comes from the celiac plexus. The direct division of the celiac plexus is the left gastric artery. All the remaining things basically arise from the hepatic artery, splenic artery, etc., etc. So that is the reason I am thinking possibly it could be left gastric artery is what need to be remembered. From where is vaginal epithelium derived, doc? Endoderm of the urogen, I think easiest question in the world. So no big deal. So it is the endoderm of the urogenital sinus. Once more, there is another small twist about this question, which can be a all India AIIPG question can come. It has got a dual origin, vaginal epithelium. Cranial 3/5 का मतलब कितना percentage? 60 is Mullerian in origin. Caudal 2/5 is basically from the urogenital sinus is what need to be remembered. Now the next embryology question of the AIIMS November 2013, which is not derived from the neurectoderm, doc. You like to say? From where is ciliary muscle developed then? Oh, neurectoderm was given. You like to say mesoderm or mesenchyme? There is a fix in that. Okay, let's go through that fix. Neurectoderm basically includes two things, doctor. Neural crest and neural tube. The retina is derived from the neural tube. From the neural crest, what is derived? Ciliary body is derived. From the ciliary body, typically the ciliary epithelium, which is important for the production of aqueous humor, is derived. Then within that body you have the mesenchyme available. From that the ciliary muscle is basically involved, is developed, is what you need to remember. Now even Abhi, Hussain, Rahul, everyone online propose the same. Yeah. Question number 8, what is your answer, doctor? Question number 8. Latissimus dorsi, very good. It is also called, what is the other meaning of the latissimus dorsi? The large muscle on the side of the back is the meaning of it, but ultimately it helps like a thoracic muscle, as a very well framed question. One question from the circle of Willis, without that neuroanatomy questions nahi hai to maza nahi hai, AIIMS लिख के. So give me an answer, doctor. Blood supply of medulla, which is accept about it. You need to think above medulla to understand what is supplying the medulla. Give me an answer at least. Superior cerebellar artery is not supplying. What is supplying the medulla, doctor? Anterior spinal artery, posterior inferior cerebellar artery, and the direct branches from the vertebral artery are the ones which are mainly supplying. Now should be an answer. VAN, the vein artery nerve, this classical arrangement is not available in which intercostal space? Why first? Because the first intercostal nerve is so small that it courses beneath the flat inferior surface of the first rib, and typically it does not have any sensory branches arising out of it. Now doctor, why not? 11th was also given, If 11th rib is there, we don't, 11th rib was given or intercostal space? 11th, because it's a floating rib, that's the reason you may not have arrangement. I think this we will once more check. I think I am not fully happy in deciding on first rib, empirically thinking that first rib will recheck. Question number 10. Tense is based on, I think, an easy question. Fundamentally, what does it lead to? If you are doing a transcutaneous electrical nerve stimulation, It is causing the release of the endogenous endorphins, which will be gating the pain transmission. So that is the reason the gate controlled therapy for the pain would be the most appropriate answer. Sympathetic supply is not responsible. In which scenario, doctor, you like to say? Sympathetic supply is not responsible for the control of the blood vessels. Some guess? We get an answer as C somewhere. Yeah, any other answer? Let's ask our online classmates. Sandeep and Durga are proposing A. Any other proposals? Any other proposals? Shailu and Hussein are also, they are proposing brain. Now you tell me, if you are angry you get sympathetic activity increased. Will you think better by becoming angry? Not really. Huh? If you look at the brain, the blood vessels of the brain, it is the myogenic control which is much more important than the neurogenic control of the cerebral vasculature. That's the reason cerebral blood flow is maintained constantly by autoregulation, not by neurogenic control, but by the myogenic control. So that is what probably the examiner wanted to implicate, because sympathetic stimulation of the blood can't be able to influence the cerebral blood flow that much as it can influence the other parts of the circulation. Okay, what was the question given as? Sympathetic, sympathetic stimulation, that means vasoconstriction. Very good, good correction from Prashant from Delhi. Maybe in that case we need to rechange the answer. So then becomes your, what becomes your answer? Skin or renal? We'll come back on that with a reference. I was wrongly notified on the question. No problem, we'll come back on that. Yeah. Anybody remember the options about the chromosomal separation? This also will come back, some incomplete questions. But that won't be really difficult question, because yeah, I mean at the end we will fill up those missing links. Excitation contraction coupling, what is your answer, doctor? So calcium basically binds to troponin but not tropomyosin. But before we go ahead, out of anatomy how many would be reasonably answered? Just like, let's look back. Real exam we should not ideally. That mesorectal fascia is a bouncer. Light microscopy mein chromosome is another bouncer. What else is a bouncer? Dermatomes are very predictable questions. I mean, retrospectively when we think how much examiner was reasonable with our life, this van is very easy, but we are not sure whether we are right or wrong. But if you take the medullary blood supply, very predictable question. Almost 70% of the anatomy out of the 10 questions are very predictable in this time AIIMS. Now let us go through the remaining questions in physiology, doctor. Yeah. Blood testis barrier, what's your potential answer? Certainly and certainly alone. So basically it is between one Sertoli cell to the other Sertoli cell which is mainly responsible for the blood testis barrier. Not very difficult, easy to answer. Fertilized ovum and uterine cavity, how much time it will take to reach? I get one answer as 3 to 4 days from the last row. What was given was 4 to 5 days. But you agree with 4 to 5 days? What will you agree with? It does not mean implantation. It means reaching. It takes 4 to 5 days, right? So Monday fertilization ho gaya, Friday tak it reached uterine cavity. That is a schedule fertilized ovum is making. After that, how many days it will take in order to implant, doctor, generally? 5 to 6 days after that. That's the reason if you start from ovulation, 7th to 10th day is the time by which implantation typically happens. That's the reason, shall we agree with 4 to 5 days? Answer looks very reasonable. Very good. This is a very simple question. Progesterone, yeah? Pregnant diol, very good. Cliver-Bucy, this is a straight repeat from the May AIIMS exam. You see everything except, so when will you get Cliver? What was given? Hyper? Hyperorality, placidity was not there. Okay doctor, is hypermetamorphosis is there? Abhi bolo answer kya hai? Anything else is agreeable. Instead of hyperorality, hyperactivity is given, no issue. Basically bilateral amygdaloid lesion lead to development of Cliver-Bucy. Will it make the animal become calm, silent, lying down, or hyperactive? It become aggressive. So that is the reason hypersexuality, placidity, and if hyperactivity is given also is agreeable. But there is no place for hypermetamorphosis. There are visual disturbances, but what kind of visual disturbances, doctor? Once more, let us go back. Docility, dietary changes, hyperphagia, hyperorality, hypersexuality, visual agnosias will be there. It can't recognize the next door cat, anjan marega, visual agnosia. So that is the thing which is seen, not metamorphosia. Agreeable, doctor? Now, how will you identify a genetic locus? RT-PCR or fish? Fluorescent in situ hybridization is immunofish, it is called as, is an indispensable tool in order to identify the presence of the genetic loci, is what you need to remember. Okay doctor, in the review recalled questions I got, acetyl CoA carboxylase was there, acyl transferase was there, thioesterase was there, remaining two we added it up. Now tell me what is your answer, which is not a part of fatty acid. D option was acyl, okay, whatever the transfer is, all right. Okay, now you propose what is the possible answer? You like to say? Question number 20, thioesterase was not an option, agreeable. Shweta and Prashant are proposing A, even Abhi is also proposing A, which is true. Basically what do you have, doctor? Ketoacyl synthase, melanine acetyl transferase, and also dehydradase, and you are having ketoacyl reductase, acyl carrier protein, and thioesterase. So these are the important part of the this thing, acetyl CoA carboxylase. What is the function of acetyl CoA carboxylase? It will convert acetyl CoA by adding a carbon dioxide into malonyl CoA. That is not the part of the acetyl CoA synthase, acyl CoA synthase complex. Now doctor, was vitamin C was given? Not given. It was given, no? So I think this is a straight question. James Lind. What is this? Huh? What were the other option? Okay, you don't agree with vitamin C deficiency? Options are okay. No, I mean this kind of questions you don't need to see other options also. So that way vitamin C, that's the reason nobody recalled even the options also. So that's good. Vitamin C deficiency. So what is the suicide enzyme, doctor? Another very predictable previous bit. What is your answer? Excellent. Cyclooxygenase. Classically it's called suicide enzyme. This is a brainy question, doctor. Brainy in the sense how carefully you read biochemistry, that is the only thing. But one question definitely will be asked on the regulation of glycolysis, glycogen, fatty acid, cholesterol, metabolism is a routine part of any exam. Okay, what is your answer? You like to say glucose 6-phosphatase? Very easy to guess. Why? Fundamentally you have hexokinase, glucokinase, pyruvate kinase, all of them belong to same pathway where glycolysis is going in a forward direction. Glucose 6-phosphatase is what is the purpose? It breaks down the glucose 6-phosphate, I mean it causes the release of the glucose. They will use the glucose, this will release the glucose. So basically when decreased insulin to glucagon means in a diabetic state. So that is the reason glucose 6-phosphatase becomes the answer. Now one more thing I like to ask you, between glucokinase and hexokinase, will both of them will be controlled by insulin or only one of them? Who among them? So another favorite question of the examiner, the glucokinase is induced by the insulin is but not the hexokinase. The differences is going to come in the All India MD PG shortly you are going to take in 2-3 weeks. Ketosis in von Guyck can be explained by all these reasons except what? Yeah? Propose an answer. You like to say B, very good. Fundamentally in our body we can use either glycogen or lipid for energy. If the glycogen can't be used for energy, what will body will try to use? Fat. So there is an increased mobilization of the fat. And when fat get metabolized, fatty acids come. When fatty acids undergo beta oxidation, acetyl-CoA forms. Acetyl-CoA is the precursor molecule for the formation of ketone bodies. So that is the reason increased fat mobilization is what you classically see in the case of the von Guyck's disease. MHC1 and MHC2, what is their major function? Some proposal? Very good, I am getting an answer. Present antigen to T cells. T cells, which type of T cells? Cytotoxic T cells, classically CTLs. It has nothing to do with initiating or eliciting a humoral immunity. I think another very easy question. Now tell me, doctor, in our do you think biochemistry which we finished, is it easy part of AIIMS November? Very predictable, there is nothing unreasonable question. You should get 100 out of 100 score in biochemistry in this paper. Now let us look at what is microbiology is all up to. What is accept about wrong statement out of all this? Somebody was proposing some other fourth option. Oh, fomepizole was given as a competitive inhibitor of alcohol dehydrogenase was given, no, not aldehyde dehydrogenase. Maybe lot of people who wrote from Vizag, Tirupati, whoever recalled, they said alcohol dehydrogenase, that's no big deal. Otherwise you propose, that's the reason it is not a competitive inhibitor, that way A becomes the answer, right? That's the reason we also did not give any answer, because if question is like this, then all the three are looking very reasonable, right? That's right. So lethal dose was given, right? Question number 26, answer becomes A if the option was given as a competitive inhibitor, right? Very easy. Then Rho kinase inhibitor is fascidyl. Rho kinase inhibitor is fascidyl because Rho kinase inhibitor is very important. It's called as ROCK kinase is the other name given, which is very important in inducing apoptosis in the cells. Any inhibition of that typically will prevent the tumor progression. Now, very interesting question. Which antidepressant, if you happen to stop, it will not really affect you? That means withdrawal symptoms doesn't occur. For any drug to not lead to withdrawal symptoms, you expect it to have a long half-life or a short half-life? Ah, come on doctor. Short half-life if it is having, if you withdraw, suddenly it is like jumping from an aeroplane without a parachute. If you have a long half-life, even if you withdraw also, its duration of action will be still preventing, natural tapering will occur. Indirectly examiner want to know out of all this which has the longest half-life. What is your answer? Fluoxetine? Very good. That looks, see, if you are not sure of any answer, you answer fluoxetine, you will be right. Because the only drug at MBBS level we will be knowing is fluoxetine. All the remaining drugs first time we will know in exam hall. That is the rule, funda. On that, where is the point in guessing? It could be that it's only what you call sonorous, some rhythmic search in the brain auditory area. Did you ever hear eflumide? Honestly, I did not hear what is eflumide, but for the today's class. So doctor, fluoxetine basically has got the longest duration of action, hence it is best. Suddenly you withdraw also, no withdrawal symptoms will appear. Okay, what is true about carbamazepine, doctor? In the present practice, the most common cause of the Stevens-Johnson syndrome is? Which is false was given, eh? Oh. You require drug monitoring. It definitely causes agranulocytosis. So maybe it does not cause agranulocytosis, then should lead to be a wrong statement if you ask me. Because a lot of cases of pancytopenias we observe in the people who are taking carbamazepine. So does not cause agranulocytosis was given? Yeah. It causes agranulocytosis, then we need to search to find some other answer. Huh? Drug monitoring is not required was given, eh? Okay. Renal failure I need to check and commit to you. Nephrotoxicity or renal failure I need to check about carbamazepine. Okay. What is the concentration of tropicamide? If anybody answered this, means they have got definite obsessive compulsive neurosis. Yeah, jaldi bolo. We are getting some good guess from the guys from the last rows. B versus D. Aapka, try and test your lucky number, doctor. Kabhi bhi tropicamide at least vial have you touched? So that is very important. Doctor, the correct answer is we use 0.5% to 1%. 1% becomes 0.01. That way I thought. But already he has given it as percentage in the question frame. he should not give, because he at least examiner knows what is the correct answer. Huh? Right. Oh, this is the most dirty question. Does not cross BBB. Why? You are all very strong about, but the option C and D were given. Abhi batao doctor. Think twice and answer. It is not a state MD entrance, national level exam. Here we can have 2, 2, 3 answers if it is state exam. Question number 31. Neha, Shweta, Anita, Shailu, they are all proposing B. Glycopyrrolate. Is it? I did not do homework to check glycopyrrolate. But yeah, I did a homework on hyoscine butyl bromide. Basically, it is also called Buscopan. Very commonly that we give, no, painkiller. So it is a peripherally acting, commonly used antispasmodic for relieving the spasmodic pain whenever we have. So antimuscarinic, anticholinergic, it is a quaternary ammonium compound. And it is the one which cannot be crossing the blood brain barrier, so that undesirable CNS side effects won't be there with the Buscopan, which is butyl scopolamine. Autonomic nervous system, physiology, pharmacology. At least 5 questions out of 200 will be there, doctor, any entrance you go in this country. Our starting point of MD preparation should be ANS pharmacology and ANS physiology. Pakka padna padega. We can't escape it. See, one more autonomic nervous system pharmacology question. Jaldi bolo. Both alpha and beta receptor. Adrenaline was there. Epinephrine is there, no? Sir, epinephrine and adrenaline are twins. Yeah. Phenylephrine was there. Okay, let it be there. But still, what is the answer? Yeah? Epinephrine? You want to say? Seenu is proposing epinephrine. Davangiri, Rahul, Abhi, Shweta, everyone is saying epinephrine. Beautiful, doctor. Epinephrine non-selectively binds to all the 4 receptors, 5 receptors. Alpha 1, alpha 2, beta 1, beta 2, beta 3. No second thought. Dobutamine, what does it do? It will predominantly bind with the beta 2. So beta 1, and it has got a weak beta 2 activity. That's what you need to remember. Oh, already. Okay, what is your answer, Flumagenil? What is that? Here 10, 20, 10, 20, 30, 40. चलो अभी आपका आंसर क्या है बोलो. Good, because your answer you remembered. No one will remember my answer. So that's good. Anytime have you given Flumagenil, doctor? Typically, benzodiazepine poisoning is very common in whom? Medical personnel. So nurse Mary will come fighting with her husband with full benzodiazepine dose, and her husband who took one full half bottle of whiskey also comes to you. You are the physician in charge in casualty. If you suspect benzodiazepine poisoning, you give 1 shot of Flumagenil. Nurse Mary will wake up and will be watching here and there. Her husband's full whiskey load will come down. I thought this lady died, but she did not. She is getting up. Doctor, maybe she is a ghost. Please check, he will ask her. But Nurse Mary immediately will fall down. Why? Because the benzodiazepine has a long half-life. Unless you once more shoot another Flumagenil dose, you can't antagonize it, because Flumagenil's life is shorter. Now how short is that life is a very important question. Yeah, 20 minutes is my proposal, but most of the books, what do they say? The duration depends on the dosage. That is another problem with the flumazenil story. And yeah, it is stated to be varying between 15 to 140 minutes. The peak effect of it will happen around 5 to 10 minutes, but in most of the times in practical scenarios it is between 20 to 60 minutes is the duration given. Now you can have your own imagination what is there in the examiner's question bank. That way 40 become right, 20 become right, depending upon the dosage which you have given. That's right. Neha proposes, Goodman Gilman says 1 hour. Very good. That's right. Now, a middle-aged man has a chronic history of exposure towards asbestosis. What is your answer? Huh? What is the most attractive answer? You are not committing. Neurosecretory granules, no? I know. How many of you have rechecked that answer? Because once more that question will come in PGI Chandigarh, there also your neurosecretory granules only will continue. That is not right, no? Doing mistake too many times. Yeah. Any other answer? Any other answer, please? My answer is desmosomes. Basically, when you morphometrically examine, if you want to differentiate a malignant mesothelioma from an adenocarcinoma, the most important clue is the desmosomes on the electron microscopy, right? So that is the main differentiator. Now, while answering neurosecretory granules, what is there in your mind? You thought it as small cell carcinoma? You also thought mesothelioma and answered, or any other diagnosis you are entertaining? Tumor cells with microvilli was there. Age of the patient is 70. That is not an uncommon age for any cancer. So that way. But good addition, good point to be added. That's good. Now, uniparental disomy, where will you not see? Mohan, you can give the question papers to the doctors. Yeah. Mohan will be charging you for the photocopying price, don't be angry on him. So, and don't say we are too commercial in charging that. So, without, if you have question paper in hand, you will be enjoying it, and you have online all these things available on the page. All right. Engelmann Prader-Willi regularly comes. Okay, I'll ask one quiz question. Silver-Russell syndrome mein which chromosomes uniparental disomy you find? Okay, not that question. I want to ask a easy question. Engelmann syndrome mein which chromosome? You will all sabotage me. But anybody tell Russell Silver? Sir, we are not still that obsessive compulsive. So it is chromosome number 7. Bloom is not uniparental disomy. Fundamentally, what is that? Both the copies only from one parent it will come. Both 15 chromosomes come from only one parent, right? Then 6-year-old Afro-American kid with abdominal pain with chronic hemolysis with a peripheral smear which is abnormal. What is your diagnosis? Sickle cell anemia, right? Nobody is thinking hereditary spherocytosis, no. Thank God, because that is also abnormal cell. So what is your answer? Point mutation. I think easiest question in the world. Which of this will lead to the development of apoptosis? One question on anti and pro apoptotic factors. Without that there is no paper. What is your answer, doctor? Question number 37. I get an answer from the last rows as Your name, doc? Rakesh, eh? Very good. From Siddhartha, very good. Rakesh, jaldi bolo. Rakesh answer is isoprenoids. What is your answer, doctor? Stalwarts of Gandhi. Huh? Some answer you need to propose for us to move. Fahima is proposing isoprenoids, which is very good. Correct answer. So basically, palmitic acid will induce apoptosis. Farnesol and other isoprenoid alcohol also will induce the apoptosis, is what you need to remember. Okay. Conjunctiva in vitamin A deficiency. Pathology questions are too fundamental. What is your answer? You like to say squamous hyperplasia? Otherwise it is not only squamous hyperplasia, what else it will lead to? Squamous metaplasia also. Will you, anybody thought stromal inflammation? I know. The main difference between keratitis versus xenophthalmia is there will be no inflammation in the stroma, but there is a stromal degeneration. So absence of stromal inflammation differentiates it from the other important causes of inflammatory states. Now doctor, squamous cell hyperplasia and metaplasia will be found. I think a very predictable question. This is another dirty question. Anybody answered means only paper is leaked, he won't answer. Jaldi bolo. And in All India MD entrance, which is an online exam, you must go and ask the institute, this much tough questions are they also there in the others papers or not? Show me which question is this tough. Otherwise, how will you compare my performance with his performance? Jaldi bolo. Pure guess only. Raucous question this is. So doctor, we have Engall, and remember this question will never come in exam, so no point in mugging it up, but microRNA is not involved. Engall, Kimban, cystatin C. If you still have some energy to read, I leave the literature for you. Okay. This is a beautiful question. According to the Delhi Anatomy Act, अगर रोड के ऊपर मर गए कोई भी आके नहीं निकाल के गए तो All India Institute Anatomy Department you can be sent. Yeah. You will be unclaimed body if no one claims for how long a time? Guess maro. 72? 72? Right? Of course, the situation of the modern parents is also like that. Elder, only 2 children or 1.5 children. One will be in UK, other is in US. Old man died, professor of medicine. Ultimately, his postgraduate students have buried him. Why did they bury? Because this fellow by chance may wake up and fail them in the exam. And how did they bury? They burnt him 1/3. 1/3 they have put him under the burial guard, and another 1/3 they have taken on to the top of the hill and left for eagles. Now tell me doctor, 48 or 72? Question number 40. Aruna is proposing B, but Tara, Fahima are proposing C. 48 hours. There is a monogram on the Delhi Anatomy Act. I leave the literature for you doctor. There are 2 different things, please don't forget. In Delhi Anatomy Human Act, for doing dissection in medical college 48 hours. Under human you have got a Transplantation of the Human Organs Act. In that to dispose the dead body 72 hours, right? So there are the 2 differences, 48 and 72 hours. I leave the literature for you. Now tell me doctor, One question on sexual offences, perversions and rape. Without that there is no paper. Yeah. What is your answer? Habitual passive agent. Any other? Sure? Question number 41. Beautiful. 41. Sarvodaya also proposes D. So what is meant by lateral traction test? Fundamentally you will be doing a lateral traction of the anal verge. Suppose if he is a regular passive recipient of the sodomy, then his anal canal is habituated for receiving the penile penetration. That's the reason it does not contract. But a person who is not a habitual passive agent, if you happen to retract laterally, then you will see for the anal contraction. So that is basically called as lateral traction test, is what need to be remembered. So in the next exam there can be some sequelae of this question that can come. What are the other things of habitual passive agent, doctor? There may be shaving of the anal hair, blood stains are not seen, etc., etc. I leave the literature for you to review. Now doctor, now comes all our 3 sections IPC. Don't you think it is too much of knowing the law and knowing very little of medicine? So, but looking at these 3 sections, don't be biased to memorize all the remaining sections. At most you can become a family court attorney. So where you are planning to become a MD in general medicine or any other subject. So now abhi bolo doctor, 42, embalming before autopsy. Try your lucky number. You might have done some exercise on this. D is the 201 or 298? Section 201 says embalming before autopsy is wrong, punishable. 297 basically what does it say? Any disrespect or undue mutilation of the corpse, dead body, you are supposed to handle also the dead body very respectfully. That is 297 IPC. Doctor or nurse telling about the identity of the rape victim, what is it called as? Which section? 228. Now assisting criminal abortion is punishable under 312. In fact 312 to 316 are the ones which are guiding the criminal abortions. During I think this is the easiest question. Cochlear implant कहाँ लगाएगा? Nose में या ear में? Ear में लगाए तो कहाँ क्या लगाएगा? Cochlear का implant का. If you just know what are the parts of cochlear implant, you can answer this. Question number